Endovenous laser ablation is a relatively new procedure in that it was approved by the FDA, the Federal Drug and Food Administration, in 2002. And the concept is that a laser fiber is threaded through a vein, and delivering laser energy to the vein, we can heat the vein up and cause it to shrink and close. So the typical vein that we would perform laser ablation on is the great saphenous vein. The great saphenous vein is a superficial vein, albeit it's an internal vein. It's inside of the leg, runs from the groin down to the ankle on the inner aspect of the leg. Typically, the way this will present is a patient will come into the office with bulging veins on the calf, and when we do an ultrasound test allowing us to look inside of the leg, we'll see the saphenous vein in the thigh that's big and leaky. If a saphenous vein is truly sick and leaking, it needs to be treated. The vein is accessed with a small needle. The catheter is inserted inside of the vein, and then we surround the vein with local anesthesia. That makes the vein virtually numb, and when we apply laser energy, which heats the vein, the procedure is virtually painless. We position the tip of the fiber near the groin where the vein originates, and then we slowly withdraw the laser fiber down the thigh towards the knee, and in doing so, the vein tissue is heated and closed. At the end of the procedure, we have a closed saphenous vein, and then when we come back looking with ultrasound at 1 month, 6 months, and once a year, what we will see is that vein shrinking down on every visit until about 1 year where we can't find it anymore. So after we treat the saphenous vein with laser, the body absorbs the vein like it would any scar tissue. So the healing is excellent, the patients recover well. It's virtually done through one little needle hole, usually around the knee. Very quick recovery. If the report is generated correctly to the insurance company, insurance companies will cover endovenous laser ablation of the saphenous vein.